The next and final presentation is by Mr. Min. Mr. Min is a researcher for the International Institute of Health, which is a sister organization of Medipeace. The IIOH was established in 2013 to strengthen the scientific approaches to project design, monitoring, and evaluation. It has worked closely with Medipeace in conducting research and evaluation for various projects. Mr. Min is a doctor of veterinary medicine and is currently a PhD candidate in epidemiology at the Seoul National University Graduate School of Public Health. His interests are in One Health, and so please welcome Mr. Min.
So when I first faced with the global health security agenda, I thought that is all about the world of government, world of academia, or world of the people in the great office, something like that, right? So I thought that the major characteristics of GHSA is multinational approach, including many countries, and the second one is multidisciplinary approach, which is also called One Health. But when I look at every document related to the GHSA, I found every first sentence they said the civil society is also another great stakeholders for the global health security agenda. So now, today I focus on the third axis of global health security agenda. Actually, when you look at the progress in the global health security agenda, it has launched two years ago, and actually in that moment, there's side event of the name is the GHSA NGO conference. They talked about the NGOs' view of global health security agenda, or what they can do, their role, potential roles in the global health security agenda, something like that. And the next year, 1 year ago, Seoul hosted the global security agenda high-level meetings, and in that place, they generally discussed about the roles of NGOs in a just general term, not a specific roles, including they don't mention about the specific role in the action packages in the global health security agenda. But this year, maybe October, there are some GHSA ministerial meetings in the Netherlands. They more deeply talked about the roles of NGOs as a partner in the JEE, which is talked about in previous presentation. So that is what I talked about. In 2 years ago, the NGO conference, they talked about and discussed about their roles, their potential roles in the global health security agenda, and that is the first place to network each other in terms of global security agenda. And here, this is the timetables of side meetings in Seoul, side event in Seoul, high-level meetings. As you can see here, there are some discussions from various organizations. They talk about what we can do, but that is just general term. Last month, their ministerial conference, they talked about the joint external evaluation and the role of private sector and NGOs. You can see here. So they talked about more deeply about the NGOs' role in the global security agenda. So as the progress of as GHSA progress, the role of NGOs also progressed in the global health security agenda. That is actually my opinion, but you can see in the trend, and I think there will be the more rules presented in the GHSA. I think this trend is derived from some opportunities and some gaps in the global health security agenda, which is actually that is global approach. So that it has two general. As Dr. Tak suggested in the previous presentation, he said there are a lot of variation according to each community and nation. So we need to focus on to each community, each local community, and also at the same time, it could be just too narrowly focused on the infectious disease, but as we all know, we have some experience and we have some duties in other health sectors as well. So within this context, we can have a role as a translators, like global approaches in the global security agenda into the local community. Or we could be act as pioneers because we are a lot of expertise on the local community context, so we can suggest some new ideas which is never discussed in the global level. So within this context, I think the NGOs or civil society can act as implementers or evaluators, like potential partners for JEE, or we can do as educators or educate or advisors to navigate what kind of goals, what kind of methodology we should apply in the more space-wise part, focus on the local community. So actually, the role of NGO is totally is only few discussions. There's only few discussions about the roles of NGOs. So that is actually, this diagram is just my personal opinion. So I think the roles of NGOs can be categorized by these three things. The first one is advocacy. So we can bring the issues, bring the problems, people out there into the global levels. So I think the global security agenda issues or other high-level meetings in the United Nations, they can, their issues, their motivation could be derived from the advocacy roles in both the NGOs. And then we can act as advisor as well. So we can, as I said before, we can navigate the right direction in the local community. And also, as all stakeholders in GHSA admit, we are the actors to implement all the plans and all just the direction into the translate into the practical term. So today I want to a little bit focus on the AMR issues to show with some examples of NGOs roles in the dealing with AMR. Actually, I think that everyone in this room may understand what is AMR. It is also called superwork, and it makes a lot of problems. Like actually, the Jim O'Neill report from the British, which is who is great British figures. He said he estimated and predicted the mortality of AMR will be increased up to, more than the cancer mortality currently. And the economic burden from AMR could be up to $100 trillion US dollars in the 2015 if we do not take any actions. So AMR is very urgent problem we need to take. When you look at the dynamics of AMR, you can see actually the dynamics of AMR in the real world, we will never know, and I think there are a lot of unknown parts of it, but simply say, it includes a lot of not only the human society but also environment or animal population. So the AMR infection could be from the animal or environment, not only from and between humans. That is the main reason that One Health approach, which is cooperation between the animal sectors and human sectors and environmental sectors, should be stick together to take to dealing with these AMR issues. So there are a lot of methodologies and framework to combat this AMR issue, but simply say the first thing we need to have is national plan, the blueprint, and this blueprint can be comes from the advocacy or the baseline assessment from the government level or NGOs. And with this national plan, we need to the integrated approach with the human sector and animal sectors as well. And there are a lot of activities we need to do, but basically to the publics and medical staff, veterinarians and farmers, we need to the campaign to proper use of antibiotics or educated them, or legal approach should be done to make a better situation. Also, surveillance capacity and new drug development is also need to be done. So that is the kind of simplest framework to combat the AMR. So all we need is the plans and actions. So to actually before GHSA, we already have the plans and actions. Like many plans come from the governmental or international organization like OIE, WHO, something like that, and many actions have done in the from the NGOs or civil society. But the thing is, the plans are usually focused on the national level, on usually the developed countries like USA or Korea, something like that. And their activities, their actions is not integrated. So it's totally fragmented, so their effectiveness is totally not satisfied what we need. Moreover, what is worse is in the context of developing countries like African or South American countries, they don't even have any action to dealing with these issues. And some countries even don't have any national plan. They don't have any blueprint to cope with them. So in this context, the global health security agenda bring when you look at the action package from the CDC website, we can find one page from action plans, which is quite long. So, but to summarize, there are three kind of action plans the global health security agenda suggested. The first one is the national action plans, the building the blueprint, and the second one is the development of laboratory capacity, and the second one is new antibiotics or diagnosis tools development, something like that. And they suggest the baseline assessment and monitoring and evaluation as well. So within this try, their goal is make the national plans on each countries rather than just developed countries. That is the main meaning of global health security agenda in AMR issues. So besides the global health security agenda, the NGOs, several NGOs also have had some roles to dealing with these issues. Like the ARC is one of the famous examples of that. It is actually not a single NGOs, but it's a group of NGOs, including many civil society organizations. So they actually act as advocates, or they actually bring or suggest some idea, the practical policy to the national level authority. WAAR is another example for that. They also act as advocates, and they also act as advisor to the national level authorities. And the third example, the Foundation for Innovative New Diagnostics, is kind of unique example as an NGO. They suggest annually or monthly they suggest new tools to diagnose the infectious disease for facilitating the proper use of antibiotics. Actually, their diagnostic tools is focusing on the symptomatic approach, so this where fit in the developing and resource limiting settings. So the NGOs have been playing as advocates and as an advisor or technical. They support. They suggest some technical support to the international or global authorities or global health security agenda, but we still need to be done in the integrated actions in the developing countries. So actually, in this part, the integrated action is not well developed even in Korea. Actually, we developed the national plans about AMR like this year, several months ago, and in terms of practical actions, we just 2 days ago we may found some news article, but may not because there are a lot of messy articles. But the articles about launching proper use of antibiotics centers, things like that. In Korea, 항생제 바로 쓰기 운동본부. It includes a lot of stakeholders, including the medical physicians or veterinary world and environmental stakeholders, things like that. So even in Korea and even in USA, they start their actions just 2 years ago. 2 years ago, so it is totally new even for the developed country. So that's why the situations in the developing countries is so kind of miserable in terms of AMR. You can see the Tanzania JE report from the previous presentation. You can see the score is 1, maybe. Right? So the situation is very bad. So we need to integrate the actions, and to take the actions, I think the NGOs are the major, could be the major actors, major stakeholders to activate their actions or plans. Is the government structure in the place is not well functioning. So they need, so in most cases, they need support from the international NGOs like us. So we have plans and kind of big blueprint from the global health security agenda. So what we need to do now is more action. So before we do some action, we need some surveillance, local level surveillance, which can be the baseline data for the specific actions. And actually, as far as I know, the Medipeace, they conducted some research on Tanzania about how the problem of AMR is severe related to the neonatal sepsis in Tanzania. So we actually we need to do that, and we can do that. So and the second one is the raising the awareness about the proliferative use of antimicrobials. So even in Korea, the situation is not good here. So many patients just take their medicine from the pharmacies, something like that. So actually, here in Korea, the government have some plans to make this more difficult. I mean, make people the accessibility to the buyers more difficult. They have some plans to make a law. And the second and the last one is the regulation, like legal approach on the AMR. It should be done to make the practical approach to the AMR, and it may lead the multidisciplinary approach on the AMR as well. So to summarize, I think the roles of NGOs in the global health security agenda or AMR issues, we have some challenges and opportunities. For the opportunities, we have some ability to cooperate with multiple organizations, so, and we have some expertise on local communities, and we can neutralize the negative sides of the securitization of health. I mean, there are several, actually the global health security agenda brings us a lot of benefits, and it's a great opportunity for us. But at some point, some opinions shows a negative point of view, like that's too global, so it may ignore the local context, something like that. So we can, the NGOs as the expertise on the local community, we can neutralize that negative point of view. And also we have some challenges. The first thing is the multidisciplinary approach. We need to take the One Health approach to dealing with this infectious disease threat. But the thing is, this multidisciplinary approaches have ignored in the. I think it has been ignored in the NGO society, because we have a lot of work related to the local context. We just focus on the local expertise, not on the discipline itself. So we need to increase our expertise in each discipline, like veterinary or medical basic understanding, something like that. So I think to communicate each other, we need to have some basic background or basic knowledge for the proper communication. So when I prepared this presentation, I saw a lot of words, like there are a lot of what like potential. There are a lot of potentials for the NGOs to dealing with this global health security agenda issues. But I think as I read some articles, I found that what we have is beyond the potential. Like as I said, we are as advocates and advisors and actors who can deeply participate in the global health security agenda. Thank you.
Thank you very much, Mr. Min, for that wonderful presentation on the roles of NGOs and GHSA. Thank you, everyone, for attending the 12th DAK talk hosted by the KOICA Civil Society Cooperation Office. Actually, now it's been changed to, the roles have been divided, I think, and now it's just the Public-Private Partnership Department. So we want to thank you very much. Again, this event was organized by Medipeace and sponsored by KOICA. And I hope you were able to learn more about the current situation surrounding the global health security agenda, with a focus on the efforts being carried out by the United States and Korea, from both the public sector and the third sector, the civil society sector. And while at first glance, the GHSA may appear to be an agenda to be pursued mainly by the government due to the wide-ranging scope, it is clear that the third sector also has much to contribute in terms of implementation, advocacy, network building, resource sharing, and engaging other private sector organizations. And while the government has its role in facilitating the communication and collaboration across countries, the civil society is in a unique position to address gaps in GHSA by collaborating both with GOs and IOs to create synergy. Hopefully, Medipeace, as a leading NGO in Korea, can continue to cooperate with the Korean government, especially KOICA, in combating infectious diseases and emerging infectious diseases in developing countries. So thank you all again. This concludes the session.